through. My name is Romy Busika. I also do have Elena Kembabazi on the other line. She's joining us via Zoom to talk about what next after the end or expiry of this 42-day lockdown. A very good morning, Elena Kembabazi. She is the program manager at the Initiative for Social and Economic Rights. How are you doing this beautiful morning?
Thank you, Romeo. It's good to be here.
Indeed.
It's been a long lockdown.
Indeed. The 42-day lockdown has expired. What is on your mind? What's the way forward?
How to avoid getting back into another lockdown.
I hear you.
I think we need to get very time. We squandered the opportunity to be able to really take the measures we needed to get our health system resilient enough. And now you've taken 42 days from Ugandans. People have been starving, dropping dead. And so we need to be able to make sure.
All right, we seem to have lost Elena's connection right there, but we are talking about COVID-19. It expired yesterday, and we'd like to get her pointers or 2 cents on what should be done next. Elena Kembabazi, we've resumed that line. Are you still with me?
Yes, I'm definitely with you. And I think that we haven't done enough. We want to know how much vaccination has happened during lockdown. Now we have the total figures of vaccination, which are about 1.1 something million people.
Indeed.
900 something first doses, 900,000 something first doses, and much fewer second doses. If you look at the minister's address last week, but we don't have the disaggregation of how much vaccination was actually undertaken during these 42 days, because that's the thing we need to understand. Like, what are those figures looking like? We also need to be able to understand how much has been done to strengthen the health system. We have some things that the government has said, like buying 3 embryogenic oxygen plants. That's in the plan, further equipping some of the lower ones. But is that enough? Remember, we were here last year, and I think we need to, the lockdown, you came to Ugandans and you said, we're going to lock you down because we have to interrupt at least the transmission significantly and get the health system ready. And we know now how devastating COVID can be with the oxygen crisis, with ICU. So have you stepped up enough on that part? And also too, without adequate testing, how do we know that when you open up, it doesn't surge? And if you look at the testing, they're saying the numbers have gone down, and that's great, but the testing has gone down. Between July 1st and July 25th, there's a significant drop. July 1st, there were like 7,000 samples or so being tested. By July 25th, they were much less, right? It's about 1,000 something. So it's almost 7 times less being tested. And we continuously called on government to do mass testing. If you see Rwanda did mass tests, targeted sampling testing at the start of their lockdown, and they were planning to do some more at different times of the lockdown to actually get a sense of what are the statistics. And this is important because, again, countries like Uganda cannot afford these lockdowns. You know, if you look at the government support, even during the lockdown, people still haven't received the 100,000, which we thought was already insufficient. But so many haven't received. So many people had the double, 2 people getting twice the amount, and they were trying to figure out errors. And those who need it have been dropping dead. So we have realized we cannot do these lockdowns.
Elena Kembabazi,
very serious about stepping up our health system. I don't know that we are there, particularly with vaccination. And I just want to say one quick thing on vaccination.
All right.
This new proposal.
All right, Elena Kembabazi's line seems to be a little bit shaky, but we now
by the government to go and to where it essentially gives the vaccines. The private sector will use the government to buy vaccines and vaccinate their workers. Shows you again that we are doing this wrong, because now it means you're only going to prioritize those whose companies have money to vaccinate their workers. And when will the people in Chikungo be vaccinated? Yet they're the ones who suffer in this lockdown. You've seen the cars, there's been traffic. Those with means and connections have been working. And the people, the traders in Chikungo, the others, are the ones who have been suffering. And yet vaccination, when you start doing vaccination that prioritizes the elite, it shows you are, again, you're trying to replicate the same situation where The elite will be okay. The poor won't be vaccinated.
Yes,
They
Elena.
will be locked down. They will starve.
Let's talk about
So
the plan, Elena Kembabazi, because we've noticed there's a lot of anxiety among us members of the populace who are saying there doesn't seem to be a clear plan for this government, especially when we were veering into this lockdown. There was no clear plan because they had anticipated that we would do vaccinations during the lockdown. Now they did not happen, meaning we didn't have a plan entering the 42-day lockdown. Now we are veering out of this lockdown. There's no messaging coming out of the government on how we are going to be living after the lockdown. What do you anticipate will happen after this expiry?
I mean, I think there'll be the usual sad and confusion, even simple things like people really want to get vaccinated, but they don't know where they're going. Yesterday I asked the ministry, why do you wait until vaccines to arrive to say where people are going to be able to go and get them? Why do we create uncertainty? What are you opening up? Right? At what point? Because this idea that we all wait until 8 o'clock to hear the president's speech, it's wrong, you people. We should be having a plan and saying if things go according to us, we'll open in this phased manner, right? What is going to happen to schools and education? Education has been hanging in balance for a year. It had just started to start a little bit. And I say that because today they'll be releasing results. And it is the poor that are again studying, even now. So what's going to happen after you open? We need a clear plan. Ugandans are anxious, they are stressed, they are hungry, they have accumulated debt, and their kids are not studying. And they need to know, okay, this is the plan. And more important, that this plan you're coming up with is not going to lead us back here. Because there are variants that are coming up every day. There's lambda, all kinds of funny things. So we have to make sure that whatever happens, we are actually learning the lesson of this, of the shortfalls here, particularly around equipping public health systems, regulating the private vaccination, and then ensuring continuity of learning and education, ensuring that you're able to quickly detect when surges are happening. So you don't wait for the surge to become so big that we have to lock down again, and that you come up with proper social protection mechanisms. If you do have to do targeted lockdowns in the future, by now you should already have a database. We don't want again the same situation of now we don't know where the vulnerable are, we cannot help them. Then weeks, people are dying, right? And there's a real plan around the economic hardship. Rent was not really, there was no rent moratorium put in place. There was no electricity payment suspension or water payment suspension. So people are still struggling with these things. And then when the lockdown also opens, people will be like, yes, they'll be coming to squeeze, we want our money. And they haven't been working. So government must actually have a clear plan to ease out of the lockdown, including the economic hardship and the stimulus package that some of these small medium enterprises need. And all of those things, they've been silent. This lockdown, unlike the prior one, it felt like we're on our own. You don't hear from the president for the most part. You are, you're hearing about the money to date. We don't know if we have actually hit the target of those who are even supposed to get money. And if we haven't, what is going to happen is the fact that if the president announces today that, okay, we have stopped, will there suddenly be like, oh, sorry, the money, those who didn't get, sorry, teachers, like, there are people who are still going to be struggling.
There's Elena Kembabazi.
I think Ugandans are anxious and stressed, and government needs to come out very clearly,
Elena,
with a plan that is equitable.
Elena Kembabazi, even if government were to reopen today or tomorrow, that would not do away or remove the vulnerability shocks that have befallen many of the members of the public. So we are saying, since even the 501,007 people who are being targeted by this COVID-19 relief were not covered, 87,000 did not receive that money. Should this money be a continuous process and not a one-off? Because we are saying, even if you remove the lockdown, it doesn't remove the vulnerability that many are grappling with. So for purposes of continuity, should this COVID-19 relief be a continuous process, Elena? Elena Kembabazi. We seem to have lost Elena Kembabazi. There seems to be a freeze, but then we are talking about the 42-day lockdown. Cases of COVID-19 have risen exponentially within this jurisdiction. 93,282 people have actually contracted this virus. And the bad news is that 2,632 people have actually died as a result of this novel coronavirus disease. We are targeting some 21.9 million people with these vaccinations. But then guess what? We've only inoculated or vaccinated 1,130,000 38,000 people plus in that regard, meaning we need to do more to cover the rest of that group. And many of the experts were saying, especially Dr. Monica Museno, that we cannot reopen this economy if we do not actually inoculate or vaccinate at least half of this population that we are targeting, the 22 million Ugandans, with these vaccinations. So that means even though we do reopen tomorrow or the next day, we need to ensure that vaccinations take root, because that's the only way we can ensure that people are protected. If you reopen and you do not embark on vaccinations, there will be an exponential increase in the number of people who are actually getting infected with COVID-19, and that would mean that we did not learn from the first lockdown in March of 2020. We instituted a lockdown, cases went down, we didn't do vaccinations, or we didn't ramp up vaccinations as we should have, and then we reopened the economy. So people came out in droves, they were not vaccinated, and they fell sick again. And now we are dealing with a second wave of the COVID-19 disease. Now, if we veer into this lockdown, no vaccinations like has been the case, and then we reopen the economy, people come out in droves, they are not vaccinated, that is a third wave. It is going to be automatic. So that's why experts are saying, even before we talk about reopening, vaccinations should take center stage within this country. Or if we reopen, vaccinations should be taking center stage as people go to work in a phased manner in that regard. And that's the argument and the compelling conversation we are having with Elena Kembabazi right here on Morning at NTV. A break is in the offing, but return shortly with the same conversation. Keep it here.